am Adalton Vilhena Stracci, Brazilian medical doctor specialized in blood cells with a background in biochemistry applied to integrative medicine within Pillar 2. I developed the Gothard inline system in dark field microscopy and the Bradford system in bright field microscopy. And we are presenting some updated research to the World Confederation of Doctors. Greetings to everybody. We are here to share with you in our laboratory some research regarding the keys for longevity from the point of view of blood analysis and the correlation with the fibers, or rather with the trabeculae, the iris fibers in naturopathic medicine, in integrative medicine, and also in biomolecular medicine. I can start with you already a work that is specifically about bright field microscopy, dark field microscopy, in vitro bright field analysis, and also in biomolecular iridology, where we study the iris fibers in relation to the inherent genetic structure that each person has. Continuing with our laboratory observation into the research done in our laboratory, I would like to show you that the dark field microscopy that you see, the biological terrain, often depends on you having unattached red blood cells, transparent plasma, with almost no toxic material, observing that there is no Headley pleomorphism in its pathogenic form, or rather, these pathogenic forms that are here show the advance of a pathology, the evolution of that pathology, and also to the efficiency of the metabolism in producing energy. Observe that these red blood cells are unattached, and their membrane maintains an efficient and elevated zeta potential, or rather, the electronegative charge of the red blood cell membrane may show that the retraction of these red blood cells will indicate good mitochondrial energy production. Look then at the in vitro bright field microscopy, and we see that there are no white formations and masses related to the cellular pseudomatrix. We can observe here that there is no elevated degree of oxidation. There is only a detachment showing that there are still some nutrients missing, but there is no pathology, nor any pathogenesis either. So, the metabolism is good, has normal efficiency, and is aging normally as well. What I want to show between bright field and dark field microscopy is precisely how we can check the level of detoxification and the good genetics that can result in a faster recovery. Observe that these red blood cells are unattached, and their membrane maintains an efficient and elevated zeta potential, or rather, the electronegative charge of the red blood cell membrane may show that the retraction of these red blood cells will indicate good mitochondrial energy production. Note that you have an excess of protein, a low HCl, or stomach hydrochloric acid, leading then to a lowering of the zeta potential, a lowering of the negative electromagnetic membrane, which causes an attraction in the stacking of these red blood cells. So the metabolic efficiency is decreased in this phase, and it shows that you also have genetics that are in functional disorder. Looking at the bright field microscopy in the in vitro analysis, notice the white masses scattered in the coagulated drop. Observe that these masses can indirectly indicate free radical formation, but also observe that the periphery of this in vitro drop in the bright field analysis is faded, that there is a degree of malnutrition and low production of antioxidants. Note that it is the same patient that is both in the bright and dark field images. Now observe this relationship that we made at the laboratory level of genetics in biomolecular iridology. The iris fibers are rectilinear and compact, so it has strong genetics and is able to have a good and speedy recovery. For the same patient, we have in the dark field image unattached red blood cells with excellent zeta potential, and therefore the metabolic efficiency of a healthy biological terrain. In the bright field, we will observe a normal fiber network without masses of free radical roots. It indicates a healthy analysis. Now let's see another patient with more fragile genetics showing in the iris of the eye. The fibers are irregular in their tortuosity, and in their spacing, and in their pigmented coloration. In this analysis of the iris, the fibers which are trabecular are tortuous, spaced, and have an orange pigment that can indicate that the patient was born with a genetic program not to eat sugar. It is all orange from a lighter iris, which is easier to see, and you can tell that she is allergic to sugar. Therefore, sugar is a trigger for inflammation. That body is in pain. In the dark field, there is a halo effect. And the stacking that we observe here in the toxic material is almost here in the center of the dark field image. It shows that there is a high level of intoxication, a low zeta potential, or rather, a low electronegative charge on the cell membrane that causes it to clump together and decreases mitochondrial energy production. In the same patient, the bright field shows a fiber network with a failure in protein production, and these whitest masses that are free radical roots may be indicating a high degree of oxidation. This patient has fragile health. Observe in biomolecular iridology when a constitution is weak, the rectilinearity does not exist. It presents a spacing at an elevated tortuosity. This orange color shows again that it is programmed not to eat sugar. Observe that it has darker areas that are stages of inflammation that are acute and overacute. Notice that these fibers also show a deeper nerve tension ring. So this person had, during their 48 years of life, much of it built up from the supermarket. It was built up from too much toxic material, too little fruit, and too little vegetables. So the epigenetic response of this patient may be actually a lot of pathology setting in. Now observe in the biomolecular iridology a strong constitution with rectilinear fibers without much spacing. Although we can't see a normal iris, this one has at least 90% excellent genetics. Therefore, genetically able to face pathology and recover more rapidly. One of the things that iridology is that it helps us to recognize the ideal pH balance. Let's remember that there it is fundamental that we have this subgaseous HCl that is precisely for protein digestion, to take in a calcium solution and to stimulate the intrinsic factor that we have in the stomach mucosa and the absorption of B12 from food. We perform a therapy with HCl in the Mafea system here in Brazil. Thus, it is the HCl at 3.7% or at 10, 20, and 30%, that we study this bioindividuality of dosage so that we see that everybody has a deficiency of HCl, or hydrochloric acid. When we manage to replace this hydrochloric acid in the stomach area in the middle of a meal, whether it be lunch or dinner, we do not use hydrochloric acid in the Maffei system in the morning, because in the morning, the stomach is already acidic, so it starts to get alkaline starting around noon or 12:30, so around the middle of lunch. Therefore, mid-lunch, mid-dinner, you take the drops of HCl with 30 milliliters of mineral water in the middle of the meal so that the digestion can be better and so that proteins can be better digested and absorbed, and that way calcium can enter in the chemical solution, resulting in a decrease of osteoporosis, especially in women. Observe then that the ideal pHs in the saliva, the stomach, the small intestine, the large intestine, the urine, and the blood pH returns to normal with the use of the Maffei system in the hydrochloric acid, or HCl. In this percentage that you can see on the slide, from 3.7 to 30%, we can then increase the absorption of B12, which is one of the most difficult vitamins to absorb from food. Therefore, we decrease the burden of supplements to the patient, increasing digestion by better digesting proteins, calcium, and B2. Note here that HCl has to be with an anti-corrosion cap. So when you ask the pharmacist at the pharmacy to fulfill the prescription, you should be careful and ask him to do an anti-corrosion test on the HCl, because if not, the HCl can dissolve the plastic cap. Therefore, to have a healthy HCl and to create a balance between the ideal pH levels, we need a high degree of purity of 38%. If you have any questions, please contact us and we will assist you. This is the biomolecular iridology. This is a pathology to show you. So, this is a 50-year-old patient. He has type O blood. He can eat red meat, but he has a high consumption of processed meat. He is actually 47 years old, and he shows an iris with a certain genetic fragility because of the spacing of the tortuous fibers between them. We discover from these arrows that appear as if it were an elevation of the stomach area there, in the duodenal area, at 3 centimeters inside the duodenum. There is a tumoral area, and we observe a wart-like elevation where we can compare to this graph from the German system. It shows that it is precisely this area that is already affected by a tumor in the endoscopic area, and also observed in the histological examination of the tumor area, which is a malignant tumor. Note that the use of processed meats, such as salami and sausages, which contain nitrates, nitrites, and saturated fats, can cause your body to absorb the fat in your plasma that is in the direction of the arrow, that indicates the dangers of these processed meats, which can form and contribute to the pathological installation of a malignant tumor. Observe that the darker the coloration, the higher the degree of the oxidation of these fats, and usually it is pork fat ingested, and shows that there's a high deficit of digestive bioenzymes, of which bromelain would be the best thing there is to digest fat. As we are talking about longevity of life, note that in our laboratory we have observed patients who use heated oils. As for the cooking that you do with rice, beans, and pasta, may not use frying. But from a nutritional standpoint, when you cook each day, the oil that is heated will routinely pass 100 degrees Celsius. The 100 degrees Celsius already shows that there is a degree of oxidation in this fat, and all the fat that goes in will not come out anymore. And it will actually start the formation of clogging atheroma plaques in these arteries, and consequently lead to Alzheimer's. Now you see in the couple, both with the wife who is 76 years old and the husband who is 78 years old, we observe a ring in the iridoid periphery that is like a cloud. We notice a yellowish-orange coloration in the 78-year-old man, the husband, that indicates that the degree of oxidation of cholesterol and saturated fatty acids is very pronounced. Regarding longevity, in dark field microscopy, one has to first look at the red blood cells. A healthy person will have clear plasma with less toxins and will notice the ideal pH levels in dark field microscopy. Now notice that in the person who already has a pathology in his longevity, he has a Hurlow effect, an agglutination of the red blood cells leading to a low zeta potential, and also a low negative electromagnetic envelope, where the contraction agglutinates. The agglutination of these red blood cells will indicate low mitochondrial energy. Also observe now that the intestinal fermentation by low HCl, or hydrochloric acid, is due to the fact that the stomach is one that releases the hydrochloric acid and takes a bolus of food sterilized by the HCl. When it reaches the small intestine, there is less fermentation. So there is less dysbiosis, and there is no lack of control of the intestinal flora with an increase in Candida albicans, which systematically crosses the intestinal wall. It goes through the intestinal pathway and ends up in the bloodstream, where we can see these Candida albicans, these whitest circular forms that you can see in the plasma, which will proliferate and which will cause greater contamination, where it will be parasitized on the red blood cells and can produce formic acid. Therefore, the HCl regulates the ideal pHs and does not provide the environment for proliferation of these candida, both in the intestine and in the ideal pHs, which will be the blood as well. In the bright field analysis, we observe a mucinous adenocarcinoma of the ovary. We can observe that both in the histological analysis, it has an inframural uterine leiomyoma and a subserosal with degenerative alterations. Interesting, isn't it, that in the observation on that specimen, there are sections presented that are completely filled with pasty and greenish material. So there is a tumor pigment that has escaped what is on top of this in the center above this agglutination, showing that there is oncological activity. The breast pigment in the in vitro analysis that was found in a breast cancer patient with a diet that was so high in dairy products. And dairy products, such as cow's milk and its derivatives, have a lot of IGF. And IGF, which is a growth hormone, can grow that tumor area, and it only has a very strong affinity with the breast. So this is a pigment that has escaped from the tumor in which it was observed in bright field in vitro. In longevity of life, the study of genes, and observing genetics and epigenetics, we must have methylation, one of the main mechanisms of epigenetic regulation of genes. Methylation refers to this coupling of the methyl group to the DNA molecule in such a way as to prevent the gene from being read or rather silenced. So we will have there the function of the methylation with an ideal supplementation which I will show you next.
ao lado para nós. Bom, seguindo,
We
nós
will now
vamos
go
entrar agora
into
na acetilação.
acetylation.
Na
In
acetilação,
acetylation, it determines the speed that an individual can eliminate toxic substances from the body, including caffeine.
a cafeína, a acetilação lenta
Slow acetylation can silence
e ter
and have
dificuldades,
difficulties
problemas
and
para
problems to
remover
remove
determinados
certain
carcinógenos.
carcinogens.
Portanto, temos que ter
So we have to have a clean organism
limpo, com uma
with a diet that is
alimentação
organic,
orgânica,
seeking green
buscando
juices,
sucos
and a
verdes,
supplementation that
suplementação
activates this
que
ventilation
ative
and
essa
scintillation
ventilação e essa
so that there is a
acetilação
function
para que
and a
haja
genetic
uma
final
função e uma
metabolic
eficiência
efficiency for us.
metabólica final,
So we're soon going to meet in a moment
Então nós vamos conhecer
the longest lived people in the
os
world,
homens de
and we're
maior
going to talk
longevidade do
about
mundo.
some habits
Nós
that
vamos
each
falar
of them
alguns hábitos
has.
que cada deles tem. Os ativadores de genes,
The supplementation gene activators and the production of energy is not only considered as methylene blue, which increases the mitochondrial energy, and then NADH, which is the final energy, where we have the supplement that you can use up to 20 milligrams maximum, so that there is a compound between coenzyme Q10, which helps us to transport oxygen and produce energy. Malic acid, which is a good energy producer, is mitochondrial as well. Inositol hexaniacinate, which is cold B3, which causes no flushing, no hyperemia, improving peripheral vascularization and brain metabolism. Note the epigallocatechin 3 gallate, which is extracted from green tea, which helps a lot to see precisely methylation and acetylation. Transresveratrol, which is an excellent antioxidant that can be used very well to activate the good genes. Astragalus is not only an adaptogen, but it doesn't allow stress to do any damage, and we know that stress itself can cause immunosuppression. Therefore, by using astragalus, we are regulating our endorphins and enkephalins so that we don't have much stress that could cause damage. Methylfolate will also activate good genes. Regarding healthy longevity, we cannot forget that we have some advice for all our patients that the quality of the water will determine the quality of the blood and consequently the entire energy production. For us to have a long life, we cannot use filtered tap water. There is no filter, neither by reverse osmosis nor by a carbon filter that can filter tap water. It is water from a reservoir, and this reservoir water contains aluminum hydroxide, copper oxide, chlorine, and sodium fluoride. Sodium fluoride, therefore, is an extremely toxic allergenic, and it accumulates in the area of the thyroid, decreasing the production of thyroid hormones. Apart from all this, aluminum hydroxide has an affinity for neural cells, and we have noticed that research shows that Alzheimer's has in the cerebral area, in the neural cell, in the brain cells, 10 times more aluminum than a person dying naturally. Therefore, we should avoid tap water since there is no filter. We should look for mineral water, preferably soft, to cook and drink. When I say soft, I mean water of mineralogical concentration that is harder and not good for cooking. Brazil has many hydromineral sources, and we try to drink mineral water even if it is of a harder concentration. But the soft ones would be better to drink and use for cooking. So when we use soft mineral water, we cannot use the same brand of mineral water where there is a region with a concentration of rocks. With a mineralogical concentration where it varies the chemical composition of this water. Therefore, we're also not interested in doing pH monitoring. Remember that we have a buffer effect to regulate this
Para a
pH.
regulagem desse pH, nós precisamos então de uma água
We need
limpa,
clean, healthy water that comes from a mine,
portanto nós
so we consider it a structural water,
Essa água
and therefore it is used on a daily basis. However, we are also going to rotate these brands that we use.
Nós temos aqui no Brasil
We have here in Brazil several brands of soft mineral water, and we have hard waters of slightly higher mineralogical concentration. What this means is that these waters can be beneficial as long as you take them and you don't use them in cooking. The soft mineral waters can be used either from hydromineral springs or from artisan wells also. As we use this water, we will have a renewal of red blood cells in our cells every 120 days. Making healthy blood plasma is the focus of using natural mineral water. Let's remember that one of the biggest problems that we see in humanity today is the contamination by toxic metals, from mercury to lead to antimony to arsenic to talc to aluminum to chrome. These are the main toxic metals found today in contamination from pesticides, as well as from the polluted city itself, which has a lot of lead. Aside from dental amalgams, which were heavily contaminated, we should also think about arsenic, which has an affinity for the skin and for the neural area, just as lead has an affinity for the neural area and the muscular area. Mercury has an affinity in the myelin layer of the nerves and also has a destructive and toxic affinity in the cerebral neural area. And therefore, we have to diminish this contamination. We have to think about the effects of metals. Thus, we have DMSA, which we can use orally along with R-alpha lipoic acid. Today, R-alpha lipoic acid causes less causticity to the stomach and greater bioavailability so that it can enter the blood-brain barrier and remove these toxic metals. So, to have a longevity of life, it is not enough just to have excellent genetics. We have to have healthy life habits, and then we want to invest these healthy nutrients in an organism that is clean of metals and pesticides in order to have healthy epigenetics. Thus, we have the essence of being healthy, which is simply not having pathologies and being free of disease. We also have to think about reducing stress. Here below, you can see on this slide that we are teaching the patient to have an ideal plate of nutrition. This would consist of protein, carbohydrates, fiber, and fatty acids. So we want to look now at the best foods in the world for longevity. That was studied in the book World Keys to Health and Long Life by Dr. Bernard Jensen, PhD in nutrition. And he traveled to Pakistan, the Himalayas, and Russia in search of the longest lived people in the world. And the foods that he found to have the best function when it came to having an optimal energy production were, first, children that were raised on breast milk during at least the first 3 years of their lives. Goat milk. Goat milk has a chemistry that is very close to human breast milk. We don't use the egg white, although the egg white has 3 grams of protein and albumin. We want the 3 grams from the egg yolk with all its antioxidants from vitamin E, lutein, bioflavonoids, and phospholipids. Phospholipids are the main thing because they nourish the neural membrane. So the egg is an excellent drug for the cerebral area. Flower pollen has all the nutrients. Turnip is an excellent antioxidant. It cleanses the arteries as well. Red or white potato rice also acts as a good brush and makes for good digestion because it goes out cleansing the gastrointestinal tract area. Burdock, which is gobo, which is used in Oriental medicine. Gobo also helps to make a good antioxidant detox. Raw olive oils are the best there is, and we do not need to check the degree of acidity of these oils, but we know that they are to be used raw and not heated. Apricot is the best food for the transportation of oxygen, and we know that divers frequently eat apricot before diving. Then we have the umeboshi, that which has a perfect sodium-potassium balance at the cellular level. So a salted and cured umeboshi has an effect of 2 sodium to 7 potassium. Green juice, which is actually a sap from green leaves, is the world's greatest detoxifier. It is a sap that cleanses the intestinal stomach mucosa and makes for good intestinal permeability without the formation of a dysbiosis. Cayenne red pepper has a very interesting circulatory function. It is excellent for the heart and helps to prevent the formation of excess thromboxane, increases prostacylin, and therefore regulates the D-dimer and the fibrinogen. There we have the Italian diet, and we want to keep in mind the main organic foods are cucumber, carrot, and beets. So we will continue with the book World Keys to Health and Long Life by Dr. Bernard Jensen, who is a world-renowned expert in the world of iridology. He has a PhD in nutrition, and consequently he wrote this book during his trip around the world, searching for the keys to longevity, where he met several people of 100, 120, and 133 years of age. And as incredible as it may seem, people of 147 and 167 years of age. Now I'm going to show you the description of his work in relation to the Hunza people, who he personally went to research and verify what they adopted as part of their eating habits. So in this city, their village, which is known as the Good Land, the land of health and long life, which is there in Pakistan where these Hunza people exist. We observed the king of the Hunza together with Dr. Bernard Jensen. And from what it looks, they even look a little bit alike. Dr. Bernard Jensen passed away at the age of 90. And here below, we see a classroom scene of the Hunza people. And here we see their main food, which is buckwheat. They had cornfields that were very high in protein. And here we want to show the father, who was 110 years old, and the son, who was 65 years old. Observe that one of the main foods considered to be the key to longevity in the world is dried apricots. By rubbing them in mountain water, they make a juice. And this juice is extremely therapeutic in that it cleanses the cells and promotes epigenetic health. Look at the 110-year-old hands without rheumatoid arthritis, without any stiffness. These men are resilient from doing a lot of hiking in the mountains. Here we have a picture of father and son. The Hunza father, who was at 120 years old, and the son, who is 65 years old. Again, we see the hands of the 110-year-old without arthritis or any stiffness. Now here, the father and son, the father at 120 and the son at 65, there are pictures that Dr. Bernard found that are painted images that you see here of Li Cheng-yun. He is from China, 256 years old. He died in 1930. Then we have Thomas Parr, who was 153 years old. This Russian, Shirali Muslimov, he died at 167 years old.
Observe o Charlie.
You can see Charlie Smith from Florida in the United States, who looked 133 years old.
133 anos. Mas o mais
But the most
curioso é
interesting
nós
part
conhecemos o senhor
is when we
Kazanov,
met Mr.
um homem de
Gazanov,
153
a
anos.
153-year-old man that he met in Russia.
Ele encontrou na Rússia.
In order to meet this Russian man,
Esse russo, o senhor
Mr. Gazanov, he
tinha
had to ask for permission from the Russian government.
ao governo russo. Observem aqui.
You can see here Mr. Gazanov at 153 years old.
153 anos.
Bernard Jensen got this permission to visit him there in the mountains of Russia. And he was asked what he ate the most and if he ate meat. He said yes. He ate meat such as lamb and mutton twice a year. And he ate foods such as fruits and vegetables that he grew in the mountain. However, Mr. Gazanov was asked, what is the secret to longevity of life? He looked next to him and he said, look at my wife next to me. A good marriage. I would say an excellent marriage. So part of having longevity of life is having a good marriage. A marriage that is blessed by the Father in the heavens. A marriage of harmony and of peace makes for a longevity of life. Interestingly, the Maori from New Zealand, who was 123 years old, was breaking the rules of healthy habits in a way that we don't approve of. She used tobacco and would have had a long life, and I would say maybe if she hadn't used tobacco, she would be living much longer than 123 years. Here we are showing Gazanov there at 153 years of age, next to Dr. Bernard Jensen, and next to Dr. Bernard Jensen's wife. It is interesting that a major key was that the elderly had the same weight that they had between 20 and 30 years of age. Look there at this detail. There you see one of the book's Whole Life Food Blend. Dr. Bernard Jensen's message was the secret of iridology is in the study of embryology. And one of the things that Dr. Bernard Jensen also said was in relation to organic foods from the sun and the earth, and the recommendation to live more in the countryside. And remember one important thing. Stop living on supermarket foods. We live on foods that come from the sun and the earth. So my wish is for all of you to have a vibrant health. Thank you. Thank you very much. Shalom.